good morning. So today I'm doing a little bit of Ultherapy, which is microfocused ultrasound. And what we're doing is aiming to lift the brows. This is a non-surgical way of treating the brow area. And how it works is the ultrasound is focused to specific depth under the skin. If you look straight ahead for me. Amazing. So it's focused under the skin, and then it heats the collagen up into the skin, or under the skin, should I say. And that produces the contraction. So the area we're going to treat is here, and the aim is to try and bring the brow up just a little bit. And looking straight ahead for me again. Lovely. So we apply a little bit of gel, which conducts the ultrasound. Got lots of gel on. And we use some topical anesthetic beforehand, and we also use some good pain relief as well, because it's a little bit pinchy. I have had this done myself, just in case you're wondering. I wouldn't do anything to anybody else I haven't tried myself. So this is the Ultherapy, this is the handpiece, and that's the transducer. You can see this is where the ultrasound comes out from. So if you can have a look at the screen for me. Here we go. Right, so this is actually the scan that I'm looking at. This is where the bone is, so actually it might be that we don't do an awful lot of treatment in this area here, because if we deliver energy under the 3.0 point, so under the 3mm G, all it's going to do is hurt a little bit, and actually the area that we're aiming for is right here. So most parts of the face, there's 5 layers between your skin and your bone. So the skin is a tiny bit of fat, then there's a muscular layer, a little bit more fat, and then there's actually the bone underneath. But actually what we want to try and do is tighten here. So I'm going to just keep scanning, but it might be that we do a few less lines, depending on what the actual picture looks like. If you look at the screen for me again. So there again, this is the scan of the forehead. You can actually see curves just along the line. That's where the skull bone is. You can see that on the screen here. So the good news is that we're not going to deliver any energy at 3mm. We're just going to deliver at 1.5. I'm going to switch the transducer. Still with me? Sight?
Yeah.
Brilliant. So again, you can see the scan. And Ultherapy is unique to any other similar device in that we can actually visualise where we're treating. And again, you can get a really nice view of the area that we're treating. Yeah, lovely. So this is the bone, and this is and you can see it's curved as you would expect, because it's a beautiful female forehead, so we get a curve on the actual bone itself. So we're just going to deliver a little bit of energy into the dermis and see what that does. Alright, so now we can crack on and have a look at the forehead again. Straighten our attention down. Is that okay?
Yeah.
How's that feeling?
Perfect.
Yeah, are you feeling like it's hot?
Slightly,
Yeah.
just a little pinch,
Okay,
but
nope.
nothing.
So it's not too bad then.
No,
Amazing.
bearable.
More painful listening to me talk. My thick Irish accent. So again, here we go. So with the Ultherapy as well, it's important to make sure we have the contact right. I'm going to turn this slightly further away from me. Bit of a pinch there,
Bit of a pinch, yeah.
but okay.
Yeah.
All right.
Mm-hmm.
You're doing amazing. Just going to turn you over here for me. Very exciting. Are you excited?
I am to see the after effects. Yeah.
And the back on the left. Okay, was that one a bit more pinchy?
A little bit.
Hey, just a couple more lines on each side and you're finished, alright? So there's a trend at the moment to do a thing called fox brows. Have you heard of fox brows?
No.
So there's a trend to do a thing called fox brows where people put little threads in under the skin to physically lift up the brow.
Right.
Quite a surgical technique.
Doesn't sound very nice.
If you look on social media, you'll see a lot of it. Personally, I think it looks really strange. We want to naturally lift the brow a little bit, but as minimally invasively as we possibly can as well. Yeah, it's going to turn you over here for me again. You've been brilliant. Still alive.
I am.
One more and then that's all we're going to do to you. Alright? Lovely. Alright. Now, water over.
Just like that.
Just like that. Yeah, exactly. So straight after the treatment, the area will be a little bit red. Pretty normal to have a couple of little, if you have a look here, a couple of tiny little, almost cat scratchy style welts that will go after a couple of days. Sometimes you can get a little bit of bruising, and particularly when you're treating on the forehead, you can get a little bit of a headache. Did you feel any zingers going into the back of your head? No, fine.
No.
Okay, great stuff. Lovely. Thanks for watching. See you again soon.